So we started the day really with an incredible day, starting with coronaries, looking at, you know, drug-coated balloons, looking at calcium modification, looking at how quickly renal denervation is growing to the point where, one of our colleagues is doing less coronaries because they're doing so much renal denervation. And then looking at acute PE intervention. I think the morning just showed how I think coronary intervention is not dead. It continues to grow. There's some very exciting new technologies, but also as interventionists, we're expanding what we can do. It's not just about putting stents in. We're trying to actually avoid stents by using drug-coated balloons, but we're also bringing in and adopting new procedures. Renal denervation is going to be an important procedure. The data continues to be very strong in support of it. Certainly in the US, we now do have some some payment for it in the form of transitional payment, and we hope to get full reimbursement in the future. I think another rapidly growing field is acute PE intervention. Pulmonary embolism is a disease of the right ventricle, and it's a disease that us as cardiologists and interventionists can treat very well. I think you also saw in that session the importance of a PERT program and a multidisciplinary team. You really need multiple people to be able to offer good care to these patients. Radiologists, interventional radiologists, cardiologists, critical care specialists, pulmonologists, all take part in the optimal management of that team, of that disease with a good team. We then switched to structural heart, and we had 3 great sessions, aortic, mitral, and tricuspid. We tried to highlight for you some of the really discussion points that are happening currently, and even some of the controversies, particularly when it comes to TAVR as it moves to lower risk and younger patients. I think there was a very candid, open discussion about how we need to talk about every patient. The heart team discussion about how best to treat a patient remains very important. And most importantly, the patient remains at the center of that discussion. In mitral, we started seeing some of the new technologies and how we have to go beyond just TIO devices into thinking about, do we need a toolbox? What role will mitral valve replacement play in the future? And then we saw a very exciting tricuspid session with a wealth of new technologies. Tricuspid really is the area where we're going to see both repair and replacement grow very rapidly. And certainly these technologies show how you can design technologies to try and maybe address some of the unmet clinical needs or address some of the limitations of first generation devices. And I think we ended it with an amazing live case that really highlights the US Focus Day, where we wanted to show you innovation at its best and how it can be used in patients and how it can improve both outcomes, procedural ease, and help these therapies get to a larger group of patients. I want to give a special thanks to all our panelists and speakers today, and a really special thanks to all of you, the audience, for participating. I was sending us your questions. I hope we addressed many of them. And please feel free when you do your online evaluation of these sessions to give us suggestions of what you'd like to see next year. And we look forward to seeing you all again at TIO 2026. Goodbye from me and Nicholas van Meegem, and enjoy the rest of your weekend.